All right.
All right, here we go. All right, well, I am Natalie Sheridan, and I am from the Counseling Center. And I'm going to talk to you about um, guidelines for informal accommodations for students in distress. So I'm going to speak with you about students that might come to you with concerns, with mental health concerns, talking with them about how to speak with them about these concerns, and about what might be useful in terms of thinking with them around an unofficial accommodation. So these are for students who are not registered yet with the university. And I want to give a shout out to Nicole Subik, who is the Director of Learning Support. She wasn't able to be here for this presentation, but I did consult with her on it, and she's a great resource for faculty and staff too with questions or concerns around this topic. And we'll talk a little bit about how the Counseling Center can support you as faculty, and also how Learning Support can support you as well. Okay. Okay, so let's start with a student reaches out and they share that they're struggling with a mental health concern, and they're not registered. You're aware that they're not registered with LSS. Students may be really specific about that with you. And I think in this current generation of young people, I think students are, a lot of the stigma, fortunately, has gone around mental health, have gone down around mental health and mental health diagnosis. So students might be really forthcoming about their existing mental health diagnosis, or they might share that they've recently experienced a trauma or a loss, and really be coming to you with that, maybe looking actually for some support. Students also might be much more private or vague. They might use like some coded or more cryptic language, like they're going through a hard time, they're dealing with a personal issue, or they describe that an absence or missed work is related to having attended counseling or having gone to the counseling center. These disclosures are often made in order to request or open up a conversation around accommodations, or to explain an absence or to make up missed work. Please keep in mind that just because a student's not registered with a mental health disability, it does not mean that it's not a legitimate concern. So why wouldn't a student be registered with LSS? Well, maybe this is pretty obvious, but the student's distress might be new or situational. And we really see this, it might be adjustment related concern. And so we see adjustment related anxiety or depression or something like that. So we see this often with students, of course, with the adjustment to college, with perhaps a loss around a recent disappointment, or in the case of a loss, like a loss of a loved one, or of a relationship breakup, which see really very common during this like period of development, right? 18 to 20, 2, 23, 24, 25. Or it might be related to something like a sexual assault or other trauma, the loss of a family home, a natural disaster, stress around something financial that's happening at home. Another reason a student might not be registered with LSS is a student's mental health condition was previously well managed, and they really didn't think it necessary to be registered with the university. And we see this a lot. Students really were doing well in high school or before, but the higher demands of higher academic demands at Villanova, the pressures of living away from home, the pressures of emerging adulthood, all the complexities that students manage during their time at Villanova. And we have a very busy student, and they really don't have the same supports and structure that they had at home. They don't have maybe a family member checking in on them. They don't have maybe their same support system. They don't have the same friend group. Maybe they have evolving friend groups, or the closeness of their relationships have yet to be really established here at school. Also in high school, there was a lot more structure in their day. And if Nicole were here, she'd really talk about the real big differences about students and how they learn to manage their time in college, and what a big transition that is for young people, especially as they're also managing to deal with their mental health concerns on their own. I also wrote The Fantasy of Villanova in College Life. And I see this a lot with working with young adults, because I think there's sort of a narrative that everything will be okay once I go to college. An individual might struggle with anxiety, or even maybe substance abuse concerns in high school, or depression. And it's like, let me just get to the next big obstacle. Let me get into college. Let me get into Villanova. And once I get there, all my problems are going to be solved. I'm going to be maybe away from a family systems that's not so healthy. I'm going to have a lot more independence. And in fact, all, wherever you go, there you are. Some problems might have resolved themselves, but there's generally a lot of other things that young people are managing. So we often see sometimes during the freshman year, students really dealing with, like, my anxiety has come along with me to college, and I didn't register, and maybe I really need to be thinking about setting up those systems. Another reason a student might not register is a student lacks resources or experiences barriers that make it really difficult for them to have had a provider, and therefore they don't have an official mental health diagnosis. So a student may really struggle with depression or something like bipolar disorder, but they've never seen a provider, they've never seen a therapist, they've never seen a psychiatrist before, or could be an emerging condition. And maybe family doesn't support mental health treatment. We see that very often at the counseling center. And so part of the challenge of this developmental age is, thinking about how is this young person going to be managing that conflict. There might be cultural or financial barriers to treatment as well. LSS is really very accommodating, I think, about working with the student to try to think about securing that documentation. And the counseling center will be thinking about them, how can we connect them with low cost or other resources off campus that could get that documentation. And LSS will often do like a temporary accommodation. So in this case, if a student's really forthcoming with you about that, like, I think I've always had depression and I really need, it's a great referral to the counseling center or learning support. And we can work in tandem, learning support and the counseling center, to be figuring out a good long-term plan for them. But in the short term, a student might really need accommodation and flexibility. And again, of course, you might have a student who's not willing to get treatment, and then just be really looking for you to be asking for some help. We encourage you not to use the language of disability unless a student uses that directly. You can't ask them. But if they're saying, I'm having a hard time, you can really be using that language with them. Okay, so I think it's often useful thinking about when we're in a position of meeting a student's needs around accommodation, to be aware of any biases around offering help. So one of the things that I think might be a potential block for people around, here's someone who's asking for an accommodation, is maybe something like, I never had an extension in college. So I thought it was useful to sort of come up with some potential ones that people might experience, and to be kind of thinking about it, ways to rethink or reframe some of those things. So I never had any extensions when I was in college. So I would encourage you to think personal experience might not always be a valid reference point. Coming from a place of compassion and not comparison is usually pretty useful, like meeting the student where they specifically are. And as long as it's a reasonable accommodation, you're going to hear me use that language a lot. That can really be enough for a student to get really back on track. So a little bit of flexibility can really go a long way for a student. What will they do in the real world when they have a difficult time? I think it's really important that we think about college as not like as an intermediate time, and that, like, what is one of our goals? This is sort of a very student lifey way of thinking about it, I think. But I'm a student life, so I'm gonna talk like that. Like, what are some of our goals of supporting young people in this time frame? We're sort of scaffolding in life skills. And I think young adults and adolescents are still kind of developing this. And they're still developing, maybe, how am I going to be able to manage this serious, potentially very serious mental health condition on my own? How am I going to be, like, building these skills in? And college is really a time of learning that. And the ways that we can help them develop awareness around that and build skills of that can be essential. So it's okay if it's not perfectly in tandem to like the hardest possible outcome in the real world, because we're in these 4 years, we are really building skills for that. And individuals, capacities are still very much evolving. And I think faculty will agree, like working with someone as an 18-year-old and working with someone at 22 does really look very different. And we know even neurologically, there's still room to grow after 22. And if we think of our own experiences, wow, I actually learned a lot more and was capable of a lot more post 22. So, like we're really thinking a lot about how can we build that in for students, not necessarily like I'm not going to offer that because it won't be that way in the real world. And Nicole sort of reminded me about this, is that individuals with, documented mental health disabilities, the accommodations in the real world for disabilities are not actually that far off from what we can offer here at what we offer by law at Villanova. So she sort of helped me understand, like, that's also not even a valid argument, because, individuals with documented disabilities do get accommodations in the real world. And that's by law. So another potential block, it wouldn't be fair to the other students. And I want us to think about that, because it doesn't always have to be perfectly, we all ask sometimes for support when we're going through a period of hardship. Even in the real world, like even as adults, like many employers, if we think about that real world example, will accommodate people for family loss, or for give you an extension on a project, or offer personal time or a personal day or flexibility. And we, I think as humans, really do ask very often for kindness and compassion around personal hardship. And I think that's like the kindest thing to do. And even as an employee at Villanova, I personally have asked for that. And I think regularly we think about how we allocate our time, and we have a lot more time with that, flexibility with that as we enter into the professional world, right? But like how many of us have put off like one of those HR trainings because we were dealing with a personal thing, or we were like, oh, I really need to focus on this professional goal. So we ask for flexibility, and generally we're really hope that people meet us there. So offering that to students is sort of a good model. Okay. Another way to think about challenging any potential bias is think about, would you offer this accommodation for your favorite student? If you would offer this reasonable accommodation for your favorite student going through a hard time, then it's really worth thinking, then I should really be thinking, can I offer this then I can really offer it to any student. So these are all ways of examining biases, and that might be potential blocks. Okay. So, well, what is faculty permitted to do for a student in distress? And I think we hear this a lot, is like, well, what am I allowed to do? On a short-term basis, faculty are allowed to do a lot. They're allowed to offer any reasonable accommodation as long as it doesn't fundamentally alter the content of the course. So for an example, if a student wouldn't be able to say, like, I'm going to be in a public speaking class, but I want to be excused from all the public speaking in the public speaking class. Like, that's not really a reasonable accommodation. It fundamentally alters the content of the course, right? So if they were excused from all of the content from that class, that might be something to really be thinking about. Like maybe that individual shouldn't be in that class, shouldn't enroll in that class, should withdraw from that class. And if you're ever in a bind where like, wow, I think what this student would need to stay in this class would fundamentally alter the purpose of this class, and you're unsure about that, actually consulting with LSS is a wonderful option because they're really good at thinking, generating alternatives for students, and knowing like this seems like it actually goes beyond the scope of what a reasonable accommodation could be. But faculty can do all kinds of other things. Like you could give an oral present in a regular class. You could say, okay, the students can't do this oral presentation, maybe because they're going through a period of intense anxiety. So I'm going to let them give me the presentation privately, or I'm going to maybe allow them to record the presentation and show it to the class and then just be available for questions or those sorts of accommodations. Faculty can offer other things such as taking tests in their office, extending deadlines, and being flexible about attendance policies. Let's see where I am in time. But if you opt to be flexible with attendance, consider engaging students around follow-up concerns. So a lot of this presentation is going to be offering some language, so I hope that's helpful for people. So sort of next steps in next steps after being, offering compassion is about thinking about, well, what is the plan here? What is the plan for the student getting the content? What's the plan for submitting work? So here's some examples. Thank you for looping me in about your recent absences. I'm sorry to learn you're going through a hard time. Given the circumstances, I'm willing to excuse those absences. It's important that we stay on top of your learning goals for the course. Let's meet to outline a plan to make up your missed work. Or so that's if you want to meet with the student, or maybe you want to say, can you propose a plan for making up the material? Okay. What is, okay, here's another option. Let's say you want to extend a deadline for a student. And I think students are often asking for this. You want to think about being specific and clear about what's expected and what the student should do if they fail to meet that deadline. So here's some language. I'm sorry to hear that you're struggling. I'm willing to offer an extension on that homework until the April 15th. After that point, I can't accept the work because I've posted the solutions in this imaginary situation, or I've reviewed the discussion points from the assignment in class. Or thank you for sharing with me about the loss in your family. I can extend the deadline on that paper by 2 weeks. In this case, it's a little bit more open. If there is a continued difficulty meeting that deadline, please be in communication with me. I want to accurately evaluate your performance and ensure that we're staying on track. Please take good care of yourself. So in all of these examples, I want to, we started off by thinking like very compassionately for students. I'm a therapist, and so I do have a lot of compassion for students, but I want to also have some compassion for you, and also be thinking that sometimes compassion or extending limits is not always what's in a student's best interest. So we're going to be like moving into thinking in that way. So offering help is great. Limits are okay. Faculty are allowed to exercise a limit to flexibility. So if a student has continued to miss class, continued to miss assignments, you should be clear with them. Like, look, the number of classes or assignments you've missed is kind of unreasonable for me to accommodate. I have concerns about your ability to master the content of the class or meet fundamental requirements. Can we set up a time to discuss other options? Being transparent with students about timelines and grading is really helpful because it puts you in a position of being really transparent about why it is you can't do this anymore. Yeah, so making clear to students can help explain why a particular accommodation isn't practical for faculty. So like if you look, I already have posted the answers to the exam. So I can't let you take the exam late. Like I've already posted the exam answers. I can't give you that exam, right? Because the answers are already up. Or if in my syllabus, I've already outlined that we will have moved on to the next material and you've already have given out those responses or discussed them, like having all of that outlined in a really clear way, I think helps students understand if you're saying no to an extension, why that's impractical for you. Faculties are not required to reteach material. They're not required to generate new assignments or provide tutoring. Could you? I mean, you could, but in many situations it's really difficult. And again, I want you to be thinking, if you're reteaching the material, how much time has the student missed? It might be time to have a more difficult conversation with the student. Um, Also offering accommodation for a student during a hard time, whether that be an isolated period of time of the semester or you're sort of keeping an eye on them through the term, doesn't guarantee an A, and it doesn't suggest that you can forgive unlimited absences, extensions, or you're granting them permission to miss, unlimited assignments. Sometimes an accommodation, so all the things we talked about, extensions, forgiving an absence, delaying an exam, may not address the larger picture. And students aren't always in touch with this, or maybe in denial about a larger picture. Like, like giving them more time isn't going to really help. And like you might have a more accurate picture of that because you have your grade book, you're aware that they've missed 2 exams, and giving them more time on this final paper isn't going to really make a difference because like they're already failing the class. Or it would take like a miracle for them to be able to reach a grade that would get to the class to passing. Um, and so that's sometimes a useful thing to think about with a student. Um, Sometimes it's not only how much time, how much do they miss, but how much content. Like you all know your courses. How much content has the student really missed? Um, I'm not a faculty member, but I have been, on the receiving end of hearing students talk about classes. And I can already tell you some students, when I hear them talk about missing certain courses, I already get like the scary tingles thinking, I don't know if the student is going to be able to make up this. You've missed how many labs? Like you've missed how many of your anatomy lectures? Like this sounds a little bit like I'm worried for you. So sometimes it's the compassionate thing is by thinking with them about like, here's why it might be really hard to make up this material. And if the student's still really struggling from an emotional standpoint, the way I often describe it to students is it's really hard to make up a lot of missed work and continue to meet benchmarks for the work at present. And that's hard when you're doing really well at Villanova. And that's for students who had to take some time off to attend an important family gathering, to have a surgery, even students who had to attend a funeral for a loved one, but in a lot of ways they're functioning okay. For students that are really going through a hard time and have missed class, if they're still continuing to struggle, it's like they're already not functioning at their best. And if they've missed too much, it's just like a really hard uphill climb. So sometimes it's worth opening up a conversation, and it might be more than one. I mean, I can almost guarantee that it's going to be more than one about let's think about whether withdrawing from this class makes sense. I think most students take some time to think about that because it's really hard for them to be in a point of withdrawing from a course. The harder option for a lot of students is considering that medical leave when they've passed the WX point. But that's when you can engage OUS, and you can engage us to be thinking with the student about whether that really makes sense for them. And keep in mind that if a student's really struggling in your class and has missed, then they're probably struggling a lot of other classes as well. And so sending an academic alert to OUS, to the dean's office, is a great way of having one body kind of look at how the student is functioning overall. And I'll let them speak to that in a bit too. Okay. More thoughts on academic accommodations. Consider putting a statement in your syllabus. This is again from LSS. Let me take a sample on. Consider making intentional policies and procedures that give students clear instruction regarding expectations around communication, attendance, For example, you're expected to communicate me 24 hours of missing a class or deadline. Putting all this in writing gives establishes a clear guidelines for students. Again, here's my my plug for LSS. It's really a wonderful resource for faculty. They can really be helping you find flexibility in your coursework, help you determine an accommodation that's within a reasonable scope. They also encourage you to maybe talk to your department head or other colleagues to see what's worked for them, which might have been helpful. You can also refer to them for study skills, time management skills, test taking skills, reading skills, test anxiety, regardless of whether a student has any documented disability. They really serve the entire student body. Here, I wonder if this link works. Does this link work? Oh yeah, and they also, it does work. They have a wonderful website, and on here is also some additional language that could be useful in like facilitating talking with a student. Okay, so tips for meeting with a student in distress. So if you're meeting with a student and they're sharing a mental health concern, you really want to lead with empathy and compassion. The main goal of the dialogue should be really around assurance and providing support. You want to speak kindly and from the heart. The exact wording is less important than really just communicating concern. So really, again, people get stumped on the wording sometimes. Like, I wasn't sure if I said this right, but if you're there speaking from like human to human, I think that's the most important message. Really try to have this conversation in a private space. I know that's pretty obvious, but pulling a student aside is probably won't be allow enough space time for a student to really share anything with you. Use listening skills and empathy, and also explain the purpose of the meeting up front, so students have a sense of like what we're doing. Like, I wanted to follow up with you around that email. You shared that you were struggling, I care, or if you feel like that feels too personal, you could say Villanova cares. I'm really worried. I'm kind of worried about you. Are you okay? Or let's make a plan. I know that we had emailed about kind of thinking about a plan for you about making up those work. I'm really meeting with you to check in on you being okay and to think about that plan together. During the meeting, express concerns, but you don't have to overextend yourself. You don't need to be this person. You don't need to be checking on them every day. Don't make promises that you can't keep. So I think people really vary in how and the closest that they share with their students. And I encourage you to be wary of any situation that you find yourself in where a student's like, well, I don't want you to tell anyone, or, I really trust you with this. So can you promise not to tell anyone? Just even when those things are done from, I think, a place of deep trust between the faculty, I usually think it puts students and faculty in really risky positions because it can really slow down the process of getting help. So I have some language around that. I realize this is really sensitive material. I can't promise I'm going to keep it confidential. In some situations, I'm required to think what's best or to share concerns with administrators at the university. Please know that I'm always going to honor the sensitive nature of what we talk about. I'm going to be very thoughtful about it and with whom I share it with. I always say, like, it's so important to honor privacy. Like, we honor privacy, faculty and staff honor privacy. Only the counseling center can really honor confidentiality. Be thoughtful about sharing your own past challenges or mental health concerns. Students often have unexpected reactions to faculty sharing their own private information. Some students really value that. They feel really validated from faculty sharing their own personal struggles, or maybe sharing the struggles of a child or a loved one of faculty. I think other students feel confused or burdened, or they feel misunderstood. Like, that's not exactly what I was talking about. I was talking about this. And so I would just say, when in doubt, unless you really know the student well and you have a good connection. I would really err on the side of keeping that conversation focused on the student's concerns. And give it, so that way you're really giving the student the message that their concerns are the main focus of conversation. Some additional tips, I would say, for students whose concerns are within normal developmental range of challenges, providing direct help can make a real difference. So acknowledging that college can be difficult, can really help a student feel normal, can make it feel like it's okay to have difficulties. Encouraging statement without minimizing uncomfortable feelings. It sounds like you're really overwhelmed. College is a big adjustment, something in that ballpark. Normalizing what they're feeling. Many students feel like you do. It doesn't show up, so you might think you're the only one, but that's not really true. Everyone struggles, something like that. Loss is hard for all of us. I appreciate you felt comfortable sharing this with me. If you feel like a student mentions something that feels like suicidal thinking, or you become concerned about their safety, use sensitive language, open-ended questions, but please feel comfortable asking directly. Thank you so much for sharing this with me. I could see you're really struggling. Are you having any thoughts of wanting to hurt yourself? I'm worried about you. Or are you having any thoughts of suicide? Avoid judgment and not questions. They like things like, oh, you're not thinking of suicide, are you? Or I hope you're not thinking of doing something crazy like killing yourself. If a student discloses suicidal thinking, or something that's in that ballpark and you start to feel worried, you want to offer assurance, support, and refer the student to someone who can help. And again, don't promise confidentiality to a student. I know it's all feels really bad right now, but I know it can get better with treatment. You don't need to feel this way. Your well-being is so important. I want you to get support. I know I can help. Let's start the process beginning together. I suggest we contact the counseling center, or let's call the counseling center, or the next one is, let's take this really seriously. Let's schedule an appointment or walk over to the counseling center. And I'll tell a little bit about our resources. QPR training, which I'm sure many of you are familiar with, question, persuade, and refer, is additional training around how to assess for and refer students for suicide, or anyone really. If you're interested in participating in a QPR training, you can contact Kathy Burns, Director of Student Life, or Natalie Edmond, and we can do a training for your department. What if a student doesn't want to get help? If you're very worried about a student, it's very important you contact the dean of students, or if it's imminent, you can contact public safety if you feel like the student's at high risk, and you feel like, oh, no, the student's not going to go to the counseling center. The dean's office can request a one-time evaluation session at the counseling center. And then we can provide feedback for what might be in a student's interest. And that's sometimes just like, we really think you ought to get into treatment, is generally the rest, but it's just an opportunity for someone in the university to be checking in on the student. In the types of Title IX reporting, here's some language around that. If a student discloses to you a sexual trauma, an unwanted sexual experience, thank you so much for what you shared. I'm grateful to learn that you're getting counseling, or you already connected with counseling. I feel it's important that I remind you that all faculty, including me, are required to report past or present instances of use of the Title IX coordinator of the university. Some of what you shared falls in that category. Please know that these reports are handled sensitively, and every effort will be made to honor your privacy. The Title IX coordinator is Ryan Ross. She may be reaching out to you to follow up. Do you have any questions about that? For students who disclose sexual assault to you, you can absolutely connect them to the counseling center. We also have sexual assault resource coordinators, SARCs. They're individuals, they aren't counselors, they're individuals at the university who will help a student connect to resources. Usually if they're going through a process of filing a complaint against a perpetrator, they will talk about how how a student goes through that process, and connect them to different resources on and off campus. Okay, here's my scariest slides. It's a chart. Here it is. Okay, here's if like students in imminent danger. Here's some examples of imminent danger. A student has ingested a substance. They're unconscious. They seem disorganized, psychotic, or aggressive. They've made a compelling threat and a specific plan to harm themselves. You can call public safety. You should alert residential life, and you should notify the dean's office. If a student endorses passive suicidal thinking, they're not in imminent danger or you don't know, please refer the student to the health center or the university counseling center. I guess it should really be the university counseling center. I think health center is there is like if we're not open, if it's after 5 p.m., students can walk into the student health center, which is open 24 hours a day, and a counselor is like on call that way. You can always call us for consultation. So any faculty and staff can call the counseling center at any time and reach a psychologist or counselor and talk with them about like, here's what a student said to me. What do you think I should do? It also might be useful if you refer to student over at any time and you feel like you're holding information that you think a counselor should know, please call us and let us know, because we actually only know what a student tells us. So if a student says, Professor, I don't know, Professor Johnson referred me over here, he thinks I'd like counseling. That's about all that we know, unless we get a consult from Professor Johnson and said, this student wrote about some really intense suicidal thinking in their creative writing assignment, and I was really worried about them. And I said, maybe you should talk about this depression with somebody. Please call us and let us know. And then that gives us a place to start from. If you feel worried, again, you can always consider alerting the deans of students for this evaluation session. If it's after hours or the student's uncooperative, again, the dean's office is a great option, dean of students office, and public safety or res life. I don't know how you all talk for this long when you're teaching. I'm more of the listening kind of profession. Okay, so this is the counseling center. We're open from 9 to 5. Our services are absolutely free and confidential. We have a private waiting area. We have staff composed of counselors of a variety of identities. We have urgent and same-day appointments available. So a student who's having an emergency can be seen basically on like practically a walk-in basis. Sometimes they might have to wait for a counselor to be available for 15 or 20 minutes, but essentially we're always available. We also have one-time drop-in appointments where these are students who are just like, I don't know if I need to enter counseling, but I do have this question, this concern. I think I'll just have a drop-in session. We offer those within 48 hours of a call. We offer groups every semester. We always offer a loss of loved one, a bereavement group, a freshman adjustment group. Right now I'm running a graduate student support group that really could use some more members. So if you have anyone that you think would be a good candidate, please refer them over. That's actually held in the new graduate center. We have a BIPOC support group. We have an LGBTQI+ support group. We have a group called Roadmaps, which is about students, seniors graduating and kind of navigating like next steps, obstacles. We post about our groups on social media, and they're on our website as well. We also have a therapy dog. Students love that. Here are our services: individual personal counseling groups. We have psychiatric consultations. So we do have psychiatrists. I'll talk more about that in a minute, but they are for students who are in treatment at the counseling center. We do referrals. So for students who are looking for long-term care, need a higher level of care or a very specific kind of treatment that we don't offer at the counseling center, we'll work with students about those referrals. We also now have a case, essentially a case manager who will help students connect with long-term referrals, help them work through their insurance, make those first phone calls. And of course, we do consultation. So anytime parents, students, faculty, or staff need have a question about a student or a question related to something that may be going on campus related to mental health concerns, they're welcome to call and contact a counselor at the counseling center. Okay. And keep moving this little picture of Stephanie around the screen. Okay. How do I make a referral to the counseling center? So here's our phone number. You can call with the student in the room. I think that's probably like if you're very worried about the student and it's an option, walking them right over is wonderful. I think the next best option would be calling them and setting up that first appointment with them. If I think the least best option would be like, here's the phone number, or here's where it is. Can I get a commitment from you to go if you're really worried about them? You could be thinking with students about talking about what a first session might look like. A first session is filling out a little bit of paperwork and then just meeting with their assigned therapist to talk a little bit about their background, assuring them that it's a free service, assuring them that it's completely confidential. Parents aren't going to know. It's not going to show up on their transcript. It's a great opportunity to try counseling if students have not had a counseling experience. I will also say if students have been to the counseling center and they said like, hey, I did not have a good experience. I didn't like my therapist. I want to try somebody different. They absolutely can do that. We make transitioning to a new counselor really easy. They just have to ask. And so you can encourage them, like, why don't you give them another try? We have many new staff, all really great. So I would encourage them to give us another try. All right, I want to make sure I have time for questions. So I'm just going to slide through these next ones quickly. Our counseling length is generally talked about. We've moved into like this equity model of therapy. So we offer counseling for enrolled students at the university, which means there's not like a specific number of sessions that students get. So, for some students, it may be that we're their best option long-term if they're appropriate level of care for the counseling center. And there's some reasons that we might, there are a number of factors to make sure that they'd be appropriate for what we can offer. But in general, most students, because of the amount of students we have here at Villanova and the amount of counselors, are seen relatively short term. And so that generally looks more like 4 to 6 sessions. In general, that is actually, most students feel pretty satisfied with that. Like most students come in, address an issue, and then they're on their way. And they might never come back to the counseling center for their next 4 years, or they might come back again for another 4 or 6 sessions around another specific issue and sort of be on their way. But at some point, if for students who have resources who are looking for or needing for long-term care, we might actually, we'll work after those 4 sessions to connect them with someone long-term off campus. Okay, I think I spoke to all this. The issue with psychiatrists, I think I alluded to. We do have 2 psychiatrists. They're both part-time and they're here during the academic year, not in the summer. They're really used as an adjunct for therapy. So individuals who are in treatment at the counseling center and we think medicine would really be useful for them, they can meet with their psychiatrist and be prescribed medication. Those services are limited in some ways that they're not covered in the summer. So oftentimes, at some point we need to find long-term options for students to take over their medication. And so again, we will work with them, or our care coordinator will work with them to be finding a long-term psychiatrist or someone to take over a prescription. The other issue is someone's like, hey, I'm out of meds. We're probably not their best option, but we will work with the student to figure out what that option is. Again, most young people kind of need help with that executive planning. Like they kind of don't know that they just need to make a phone call or two to their prescribing doctor at home and be like figuring out how to get that. And we usually help them do that. Our limits of confidentiality are, like I said, we're completely confidential. We're all licensed counselors. Our limits have to do with if an individual is a danger to themselves or others. Parents are never notified except in those extreme situations. We do sometimes encourage students to engage parents, especially if it's clinically appropriate, especially if we want to be thinking with them about finding a long-term provider and their relationship with parents. That seems workable. That might be a treatment goal that we integrate into our work with them. Okay, so I want to leave a little bit of time for questions. Please remember that we're here to help as we think through this together, and we're happy to consult with you about a student that you're concerned about. You're welcome to call the counseling center. And again, Nicole wasn't able to be here, but LSS is a wonderful resource around talking about specific accommodations for students. So I'm gonna stop sharing my screen, which I think is this button, and open it up.
Thank you again, Dr. Sheridan. That was a very informative presentation. Very helpful. Even I learned quite a few things. So thank you so much for sharing that and being willing to take some time out of your day to answer some questions and go over these important topics. We do have 2 questions. The first one being how to handle students who keep pushing for more even though rules have already been bent for them.
So I would say for a student that keeps pushing, I think the answer is really trying to hold a limit. I think if a student hasn't been able to meet the requirements of like the first accommodation, and you're looking at where the student stands in the class and a second accommodation doesn't make sense, I think the more compassionate thing to do would be having a conversation with that student about like, this doesn't really make sense. If it's more about like, I don't love that they're asking for something different, but it could work for them, then I think that's also looking at that first piece. Like, is there a reason why I'm not wanting to do it? But I think it could work for the student and maybe they need it. So those are like, I think the two layers there.
Next question here is in terms of reteaching material when a student is an athlete, like when a student is ill and missing multiple assignments in classes, can a faculty member connect the students with LSS in order to organize all assignments due and talk through whether they might have to WX then? Or should a faculty member go through the athletic advisor?
So I have to be honest, I'm not sure about the athlete question. I mean, I don't know. So I would probably speak first with Charisma. Do you know? Because you just turned your camera on.
Sure, I did.
You do?
As far as the athletes, I always say that it's great to check in with Jim Brophy, but you can also advise students that LSS has academic coaching walk-ins. And so the students, athletics works with learning support services too. So we all work together. So they'll get that announcement. But yes, they can meet with LSS. And if the professor is willing to allow them to turn in those submissions late, they can set up a schedule for how they're going to do it, and then they can present that to the professor. And if the professor approves it, then they can continue to work with LSS and the student with that. But the student would have to initiate that, and they can do that with their athletic advisor or with LSS.
Okay, thank you.
I would also like to quickly mention the first part about if a student is ill and missing classes. You can always encourage the student to reach out to us directly. So ousretention@villanova.edu or just the Office for Undergraduate Student email is also completely fine. They'll refer that email straight to us, but the student would essentially need to fill out an attendance verification, and where they can find that is in their MyNova. So in the search bar, they can type in OUS forms, and then attendance verification is one of the links that will pop up. So they would just need to fill out that form and submit documentation, and then our office can excuse any absences that they miss as long as it aligns with university policy. So I just wanted to mention that part as far as like attendance and if a student is ill.
Sheridan. Oh, yeah. Yep. I know that we only have 5 minutes, so I'm going to rush through it. You have 2 questions that I think are really important. The one was, I'm wondering about how to approach the conversation with the student about WXing a course. We all know the deadline is April 3rd. the person asks, are there things that are useful to say or ways to support that decision? If you could respond to that.
Yeah, I would say please be direct with students. I think that doesn't mean that you have to be harsh. I mean, I think, but being direct with students is really important. Like if a student is not going to pass this class, or it's going to be tremendously difficult, like it would take a Hail Mary miracle for them to pass. I think the compassionate thing to do would be like, my recommendation is that you WX the class because of X and Y and Z. Like provide the information for the student. That doesn't mean that they're going to digest it and take it all in. The student may opt not to do it. But I think you'll feel better about being transparent. I often hear from students like, oh, the faculty was really nice to me. They said I could do it or that I could not do it. And I think I decided not to do it. But now I'm like, maybe I should have done it because I don't think I'm going to. And then they're kind of in a pickle. And then faculty end up feeling like they're in a pickle at the end of the semester because they're like, I don't really want to fail this person because they have been really having a hard time. I feel really bad failing them. But they just didn't do they didn't do the work. And I think all there is to do is to fail them, honestly. So I think the opportunity to have the withdrawal is a wonderful exit ramp for students. And just make sure that you have a compassionate, forthright conversation with them where you say, I really want you to think about this because it really could be an opportunity for you to protect your GPA, to invest your time in your other classes. So I really want you to be thinking about, focus on taking care of yourself from a mental health standpoint.
Thank you. The last question. Occasionally students go AWOL and only seem to be responsive via email. Once the matter has been escalated to their advisors and or OUS, do you have any recommendations for approaching these concerns without generating ill feelings on the parts of the students?
Oh, Charisma, this is like your jam too. I don't know if there's a way to have students. I think students are usually in this case avoidant because of deep shame that they're having around their own performance. They've usually missed some class. They feel badly about having missed that class, or they have so much anxiety about what it's going to feel like to walk back into that class. So I don't know if there's a way to, I think they're already feeling shame and anxiety. I think it's okay. Like these consequences are just sort of going to happen. I think, again, the compassionate thing to do if a student's missed so much material would be contacting them, doing an academic alert, maybe saying to them, you've missed a lot of class. I'm checking in with you. I want to make sure that you're okay. Given the amount of class material you've missed, I'm really worried about you meeting the academic requirements for this course. It might make it seems to me that we should have a conversation about whether WXing the course would make sense. Can we please arrange a time to meet? Chances are the student probably won't respond, but I would probably feel better having sent an email like that, please be in touch with me. And then of course, referring the student to your office, Charisma, because I think they do a really good job of trying to loop students in and then getting the student to us. Because essentially, if a student is not performing in your class, it's very likely that that's extending in other classes. And sometimes we need to work together, be thinking with the student about a medical leave of absence. And that's really when the counseling center and OUS work together, thinking about what's going on with the student and what kind of treatment can they get online and what do they really need right now.
Thank you, Dr. Sheridan, for presenting to us, and I thank everyone for showing up. We thank you for your continued support of our students and for working with us and partnering with OUS. We will continue to offer workshops based on your concerns and common themes that we're hearing. If you have any ideas for workshops that you would like to see more of or have us complete, please send us an email. We're always willing to work with you and to partner. Just so you know, we appreciate you. We appreciate everything you do. We appreciate the flexibility We know it's also hard for you because you are also parents, friends, siblings, married. And so we appreciate that. And so we just don't want to leave without you knowing that we thank you for supporting our students, and we are going to continue to support you. We may not get it all right all the time, but we're open to hearing it, working better. And once we know better, I can promise you that OUS does better. Thank you all.
Well, thank you all too. Thank you for
Thank
having me.
you.